So how do we approach caring for our vulva, vagina, and pelvic floor from a more trauma-informed perspective? We have to work with the nervous system. And also, we need to work from the outer edges of our body and gently, slowly titrate our way to doing more intimate work, like touching our vaginas, both externally and internally. So, this looks like using your breath, first and foremost, to restore that responsiveness that Kim so beautifully talked about, so that when you are in labor, again, you have that muscle memory of, okay, I'm having this intense experience, but I already know, I've already practiced relaxing my pelvic floor, right? Through your breath, but also changing positions, movement. And then when we have our body's consent, moving towards looking at and touching our vulva and vagina, using a mirror, using sight as biofeedback, as well as touch. So one of the slides I had that I wanted to show you today, I don't know if we're going to see it, but I just want to speak to it. There's a ton of nerves that flow through your vulva, vagina, and pelvic floor. So our pelvic floor is deeply innervated. And this is another reason, right, that we have to work through the nervous system to target issues going on in the tissues of our pelvic floor. So I'm not sure what happened, but that's okay. We're just gonna use our imagination. So picture all of these veins and blood vessels and nerves that flow through. And what's really cool about these nerves is that they branch out uniquely in each of our bodies. So some of us have more nerve flow around our perineum. Some of us have more in our vulva or our clitoris. And pelvic mapping can be a really fun way to explore where you have more sensation. What's really interesting is studies also show that because our nervous system is so connected to our pelvic floor, those of us who have a more hyperactive fight, flight, or freeze response in our nervous system also have what's called a hypertonic pelvic floor, which basically means a overly stressed, tense pelvic floor, which Kim talked about. We talk to any pelvic floor PT, and they'll tell you that we all have this hypertonic quality to at least some of the tissues of our pelvic floor. And when we're pregnant, we want to help restore nerve flow because nerves actually move our muscles. Now, nerves run alongside blood vessels, as you can see in this picture. And for most of us, those blood vessels don't have optimal blood flow. You might be able to sense into this just even trying to connect to your pelvic floor. A lot of us are like, I don't even know, how to do that or how to feel into that. And some of that is because of the lack of circulation that we have going on, which directly impacts nerve flow. So through massage, we restore blood flow. We also restore optimal nerve flow and sensation, which helps us to stay connected and actually relax our muscles so that they can yield and let our babies through.